We will use the postal service, and we continuously are looking to continue operations to meet the needs of the public. And we are determined to provide the best course of action for everyone's health and safety. State agencies continue to change our standards this week, and we are moving away from face-to-face appointments to allow for interviews by phone in most cases. So the current need for social distancing for the public safety is our highest priority. And the county is working to deliver services to our residents as safely as possible. So we are currently open for business, and we continue to make appointments to conduct our business as best as we can. So we will be posting our numbers in the newspapers for you to get a hold of us with every department. When this ends, and it will, every game will still sell out. Your favorite restaurants will still have 2-hour waits, and kids will still cherish school. People will appreciate their jobs, and the stock market will skyrocket, and we will all celebrate and shake hands. And there will be a great day to celebrate and all get together. So hang in there, as we are doing. We're working around the clock to stay strong, to prevail. And, you know, we are adopting to new realties. We are creating a new roadmap forward and taking positive steps to make as smooth as possible the taxpayers in Orleans County and the way we serve them. So at this time, I'm going to introduce Paul Pettit, our health director, to give you an update on the one positive case we have in Orleans County. Thank you.
Okay, good afternoon, and thank you, Madam Chairman. Appreciate the introduction and having you back. I know you recently arrived back from a vacation. So I'm going to be providing a update as I've been doing over the last several days, and as we've talked about, we want to continue to do this on a regular basis. We're planning again to continue to do these at 4 o'clock every day. Just an opportunity for us to touch base and let you guys know what's going on locally in our counties. You know, obviously we have news media in Rochester and Buffalo, but again, we're unique here. We're special here. We want to make sure that everybody knows what's going on locally to the best that we can. Factual information is very important. And again, we've been talking about it all week, just making sure that information is coming from us and that you're hearing it as real time and we're being as transparent as we can. So as was mentioned, we are trying a new format here. This is going through a Zoom meeting platform, and I know our media folks are recording or live broadcasting, so hopefully it looks good on your end. And we're again trying to practice what we're preaching in social distancing and keeping one another's apart from each other as best we can. So again, we will be providing these daily weekdays. We will only be doing it on the weekend if needed for a special occasion or if there's something that we really need to get out to folks in a timely fashion. All right, so again, we've talked a little bit about protecting folks' privacy when we talk about confirmed cases and any type of medical information. And as we continue to move forward with more cases coming online, we're going to continue to hold to that. It's very important that we protect people's health information. I know it can be frustrating by some folks not being able to understand and know exactly what's going on and where cases may be. But it is essential for us that we have a good understanding and we're maintaining people's privacy during these times. But in trying to, again, meet people halfway a little bit on this, we are going to start offering up general locations in our counties, and we're going to do that by third. So we typically speak in both Genesee and Orleans County around east, central, and west, or west, central, and east, depending on which direction you want to go from. So we will be releasing information relative to that around positive cases. I do want to have folks keep in mind, and we've been saying this all along, that residence is not necessarily the most indicating or the key factor in determining location of disease, especially when you have community spread. As we've been talking about with community spread, we all travel. We all go around the county. We go to different counties. We travel out of state, around the world. So when you have community spread, where you live is not necessarily the biggest indicator of potential exposure. But we are going to try to, provide additional information as we can. So a couple updates situationally. I'll start with Genesee County. And again, we're stopping the clock at a certain time on these, so we have time to get accurate reporting and numbers. So 2 o'clock today is when we pulled all these. Again, there's activity in the background going on as I speak. But as of 2 p.m. today, we have 1 case in Genesee County of COVID-19, so we still only have 1 confirmed case. And to update the information, just what I explained about the different regions, this individual resides on the east side of Genesee County. In regards to this case, contact tracing continues at the Genesee County Health Department. They've been working literally around the clock to identify additional cases and contacts. And as we're doing that, those cases are being put under mandatory quarantine and swabbing for COVID-19 as indicated for those folks who are symptomatic. So a brief summary here. In Genesee County, we have 7 people under precautionary quarantine, and we have 15 people under mandatory quarantine, and 1 person, our lone positive case at the moment, is under mandatory isolation. So with those numbers and updates, you can see that our mandatory quarantines have increased significantly, and those are a direct result of our confirmed positive case. In Orleans County, as the chairwoman just announced, as of 2 p.m. today, we do have our first COVID-19 case in Orleans County. I do want to report, though, this is a little bit unique. The resident was asymptomatic while home in the county, and they were not swabbed, but they, obviously, because we were not aware of them at the time, and they traveled out of state for a vacation, and the person became symptomatic a couple days after leaving Orleans County. They are now in that state and under mandatory isolation as testing positive, and they are down there in the time being. So the individual resides in the western part of the county and is above the age of 60. So based on the developing timeline, again, this is very early on, we believe the transmission did occur locally, mainly due to the fact that due to the onset of symptoms in the incubation period, where the state has determined that this is a local case for us. So again, we're working with the State Department of Health to look back how far we need to do contact tracing and trying to identify folks that may have been in contact with this person. We do have some folks under the initial investigation so far, and they have been placed under mandatory quarantine and are being swabbed as indicated. Overall, generally in Orleans County, there are 0 people under precautionary quarantine officially. 10 people are under mandatory quarantine, and we have 0 that are under mandatory isolation. And again, going back to the fact that our current 1 case that is being identified as an Orleans County resident is currently not in our state. As a reminder, our people that are under investigations or PUIs, again, as you hear some of this terminology, they are being monitored multiple times per day. Precautionary quarantines are checked on once a day via a phone call to make sure that they're doing well. We're checking for symptoms, fever, other respiratory issues. And then our in-person, our mandated quarantines and mandated isolations are visited once a day in person and also called another time per day. So we are in a lot of direct contact with these folks and checking on them, making sure they're being, adhering to the quarantines, and that will be ongoing until we hear differently from the state. All right, so a couple general things on information, things that I wanted to share and just remind folks of, and then we'll get to some questions. So we've been talking about community swabbing quite a bit this week and the lack of availability, and unfortunately I can't stand up here and say it's got a lot better. We continue to be frustrated by the lack of swabbing kits available. We do again have a very small amount within our health departments, and that's still very unfortunate because, as we all know, we do have some community spread going on, and to be able to find out the extent of it, we need to be able to swab and test more. So we continue to be frustrated around that. We do know of several primary care providers that do have swabbing kits, and they're getting them from their healthcare system. So again, we want folks to call ahead to their healthcare providers first. If you are symptomatic and having respiratory illness, and discuss with them your symptoms. Do not show up at the office, call ahead, and they may be able to help you there. We are currently in planning phases of having drive-through swabbing clinics, maybe what you have seen around the state or in other parts of the country. We're getting all those set up, and we'll have more information on those locations. and how those will be set up in the near future. We'll be announcing that. One thing we are hearing a lot of too, that providers, when they do testing, are putting people on home self-quarantine or self-isolation. And this is something that we are not fully aware of in the health department. Again, as more testing and swabbing comes online, it's very difficult for us to keep track of that. We are actually getting the results on the back end, which is fine. We know that's going to happen because we can't keep track of the swabbing, which is okay, because we want people to get swabbed if they're symptomatic. So when that happens, you may be placed by your provider on a home quarantine or home isolation, and which is fine. We just want to make sure that, again, you're letting potential first responders know, you're letting other people know that you are symptomatic and that you've been tested, and you're waiting for those results. So make sure you're communicating that with family and friends and with first responders, so that we can help reduce and avoid potential other exposures. All right. Again, we talked about swabbing sites, and one thing we talked about yesterday, there were some questions around hospital capacity. As we know, the potential, again, cases of severe or folks needing additional care is predicted to be higher potentially than our local hospital beds and capacity. So we have been following up with our different health systems in both Orleans and Genesee County, and they are making plans. They are working on coming up with some different contingencies. They're looking at additional capacity within their buildings that may not be in use now, or within their healthcare system. So UMMC has some sites in Batavia area that they're currently looking at revamping and putting beds in and standing up as kind of temporary hospital or bed areas. And Orleans Community Health over in Medina is also doing the same. So we are trying to ramp up and get ready and be prepared, obviously, if we need to get there and it comes to that point. So a reminder with community testing and looking for places to get swabbed, et cetera, it's important to call ahead. Do not go to the urgent cares. Do not go to the emergency rooms. Just don't show up there. Obviously, if it's a life-saving emergency, call 911 and utilize them for that services, but try to announce and let them know if you have any respiratory illness in advance so that they can protect themselves. Again, the last thing we want to do is lose our EMS providers and our other first responders from the field, and they lose their ability to help others out because they're under their own quarantine. School reminder, just real brief. Again, obviously a lot of the schools are out, and there's a lot of different schools are doing different things. We are encouraging folks. We're getting calls here at the health department about what's going on in the community. Please call those agencies directly. We are trying to keep up with exactly what everybody's doing, but as you can imagine, it's a bit of a daunting task. So call your local school districts, ask them. They may have feeding sites, drop-off sites, for other things. And the best way to go is right directly to your school district, their website, et cetera. So that's another important thing. Another thing we just want to remind folks is this can be a very trying time and very difficult for folks, and a lot of anxiety and stress, and we fully understand that. And we want to really make sure that people are taking care of themselves from the mental health side. And if you are feeling anxious and with that anxiety, there are folks that can help. Our Orleans County Health Department, our Genesee County Mental Health Department, they are available. They're available to talk to folks and help out. So we again want to encourage, if you're having issues around that side, that you're reaching out and you're connecting. You don't need to be alone in this. We can all work together to help each other. So again, we're encouraging folks in an emergency to call the Care and Crisis Helpline, which is available 24/7 in both Genesee and Orleans County. I'm going to read the numbers, but we'll have that available again in print, but it's 585-283-5200 or text 741-741. So again, if you're feeling anxious or stressed or you need someone to talk to, please do that. The help is there and available. Again, we want to refer people to our county websites for additional updates and information. As you may know, or has been reported, the Orleans County website is down due to some viruses and attacks on that. So they are working diligently to get that back up and running. But our Genesee County Health Department website is a mirror of the Orleans County one. So all the information, all the guidance documents are all there, along with the daily count and numbers that we have for both of our counties. So just, I'm going to wrap up. We'll open up the questions here for the media. But I just want to close with, throughout this outbreak, I've had the privilege to see a lot of significant community movement of coming together with a focus on care and assisting of others. We're getting frequent calls every day by people wanting to help, people wanting to know how they can be part of the process and part of helping their neighbors and helping other folks in their community. And I know we're all dealing with loss at some level. Whether it's our ability to go to work, whether it's our ability to feel a sense of control. And this is an unprecedented time. And we all here are elected officials here at the health department, other county officials. We want to remind folks that it's important to protect others by protecting yourself. And together we will persevere through this and move beyond these trying times. With that, we're going to open it up for questions, and I will try to answer those. And I know Lynn is still here, so if there are questions in regards specifically to Orleans County operations, or if again, maybe there are questions for Genesee County. I believe Jay Gazelle and company down there are online. Maybe they can chime in if there's questions in regards to them and operations, and we'll open it up at this time.
Okay. Paul, it's Tom Rivers. Can you hear me?
I can, Tom. How are you today?
All right. I'm not a Zoom guy usually.
Welcome to the world.
I wonder, how many beds are there actually at Medina Hospital?
Yeah, that's a great question. I believe their current capacity is around 19 that they have potentially available, but I'm being told that they could free up to 38 beds. Again, we know that they've closed down some wings in the last couple of years, and they're not currently stood up as patient beds, but I was told that they can make them that way fairly quickly. So they are in discussions and working on that. Their concern over there obviously is even if we can create the bed capacity, there's a concern on staffing those rooms and that. So we're currently looking at those logistics and trying to make sure we can have what we need available if and when we need them.
I guess I wonder about your staffing. It seems like if you had to trace someone's trajectory for a few days, that would take a lot of time. So I don't know if you need people.
Well, that's a great question. We've been talking about this a little bit in some of these other press briefings. The reality is, none of the health departments in this state or this country are staffed appropriately to respond effectively to this level of an outbreak and pandemic. Obviously, all county government and municipalities have been shrinking over time. We've been obviously in creative ways of delivering essential public health care services with our partnership with Go Health and working strongly between Orleans and Genesee. All I can say is that, I'm very proud of our staff. They've stepped up to the plate. They're working long hours for you guys, our residents, to protect you and keep you safe. And I couldn't be prouder of them and the work they're doing. And, we're having calls for volunteers. And again, it's a challenging thing because it's trying to onboard people with just-in-time training during an emergency, which makes it challenging. But again, we're working with other county staff, that may be able to help us out, that may be part of some of the pullback on county operations. So we're working through it, we're managing, and again, the goal is to provide this information and do the contact tracing and keep you guys safe as best we can.
If Tom is done, this is Howard Owens from the Batavian.
I might jump in later, Howard.
All right, Howard, you're up.
If you're okay, if you got more questions, Tom, go ahead.
Well, I don't know if the question is this a well-trafficked person? This person who had the confirmed case. I don't know if in general we should feel like we're all getting in contact with people who very well might be positive.
Well, so as I was sharing, Tom, in the beginning there, when we're talking about community spread, it's just like influenza, right? This is like any other common disease, any coronavirus, any common cold, right? It's around in the environment, it's around where we are, which is really why we're in this extreme social distancing environment that we have found ourselves in. Again, trying to separate people, trying to break the cycle of this virus from exposing each other. So, the reality is, we want people to operate to some sense, and not out of fear and anxiety, but just, practice the basic precautions we've been talking about, right? Washing your hands, staying home if you're sick, those type of things are very important to trying to break that cycle. But yes, with community spread, it could be around, which is why it's very important on the front end that we identify these cases, we do the contact tracing, we quarantine or isolate if they're ill and confirmed positive, again, to keep them and try to break that cycle as best we can.
Okay, thank you.
Okay, you finished, Tom?
I think so, Howard. Thank you.
Okay, great. So, Paul, you mentioned talked about people getting tested by their provider, and you're not necessarily aware of all those tests that are going on and who might be under some sort of quarantine based on the recommendation of the provider. If somebody is symptomatic or has had contact with a person who is symptomatic, do you get notified of that? At what point do those providers, are they required to notify you of anybody who may be symptomatic?
Yeah, so we can talk about that process a little bit. And as I mentioned, this is going to get more involved and harder to follow, obviously, as more swabbing comes online. But, again, what happens here is these providers are swabbing people based on symptoms. So they're not just swabbing well people, those without any symptoms. These are people presenting with some level of a respiratory illness. And then based on screening criteria, again, what we've been talking about all week, again, our elderly and those with immune compromised health systems or underlying health issues. Those are the folks who we're really trying to hone in on with our very few limited swabs we have here in our region. But what happens is when those go into the lab, again, they're getting tested, and then we find out about the results on the back end. So we're constantly throughout the day pulling down these test results. And as they come in, obviously we can see how many were done and that they were negative. And then if they are positive, as I've been reporting, we will receive a phone call directly from the state lab and notified immediately of those positives. And from that point, that's where we start our contact tracing. So we're going to be contacting that individual and then again, starting that process of looking backwards and building the story of where they may have been and who they've been potentially in contact with.
Okay, if somebody else has a question, they can jump in. I'm reading back on my notes. Okay, I found my question here. So what I wanted to ask about, so there's 15 new positive, or you've got 15 positives, so it's 5 new over yesterday. Are any of the 5 new symptomatic, and do they have an association with the 1 positive in Genesee County?
So they're not, so there's not 15 new positives, there's 15 new mandatory quarantines, just to make sure we're clear on the language there. So yes, most of them are associated with our confirmed case. And again, as I said yesterday, that circle is going to be expanding as we continue to talk with folks and try to identify, who they may have been in contact with and how close that contact was. So yes, most of those are related. There are a few of them that are symptomatic and they have been swabbed, and we're waiting on those test results. We have not received any as of 2 p.m. today.
Thank you for correcting my language on that. I mean by the 5 new who are in quarantine. Are any of those 5 symptomatic?
I don't have that right in front of me, Howard, but we can report on that tomorrow.
Okay, and then you mentioned that some of the people under quarantine, mandatory quarantine yesterday were symptomatic. They've been swabbed. I take it those results aren't back yet, or do you have good news to report that they're not?
Unfortunately, we do not have the results back. They are at the labs. Again, this is a big problem we're running into, is getting these results run in a timely fashion. As you can imagine, that they're swamped with samples. More private labs, we're being told, are going to be coming online every day. We wait for every day to come, and it doesn't seem to come quickly. So we are waiting for additional capacity. And we're hopeful that when that does arrive, we'll be able to test a lot more of these swabs in a quicker turnaround period. But most of these labs are 2 to 4 days on getting us results back. So that's why it's very important that if you are symptomatic with respiratory issues, you stay home, you self-isolate, again, because you're symptomatic, try to avoid contact with others, and wait till you get your test results back.
That's all I have. Thank you, Paul. Thank you for all the information.
Sure.
From down here in Genesee County. Hold on.
Sure.
Hi, now it's Fox Daily News. Sorry. I was having a bit of a hard time. Did you say that the case from Orleans County was out of state?
Yes, the current confirmed case from Orleans County, that individual is currently out of state.
And you said that they weren't, they were asymptomatic?
They were asymptomatic while here in Orleans County.
Okay.
So obviously that's why they were not swabbed or identified, because there was no symptoms before they left when they arrived in the other state. They became symptomatic and were then tested and confirmed positive with COVID-19.
Paul, could I ask one more question?
Sure.
Well, I've seen on Facebook, people, they do wonder how many people have actually been tested in Orleans and probably in Genesee as well.
Yep.
So I don't know if you know roughly.
I honestly don't. It's not a number that, is something, I mean, it's probably a number we could pull with a lot of digging, but our staff, as we just talked about, is running around trying to keep up and manage the folks that are ill and being quarantined. Again, the number tested is an indicator of illness in the community, but it's something that it's hard to track, and we're really more concerned with obviously positive results, not necessarily negative ones.
Yeah. Okay.
Yep.
So Paul, if there's no other questions, we'll do this again tomorrow, 4 o'clock, same time, same station. You'll still be our moderator.
All right. Well, appreciate everybody's time, and hopefully this format worked well. And again, we'll continue to do this and provide updates on a regular basis, daily for now, and we'll let people know if that's going to change. But again, continue to adhere to the guidance that we're talking about, making sure you're staying home if you're sick, calling ahead before you present it at your provider's office or one of the emergency rooms or urgent care centers. And again, wash your hands frequently and help protect others by protecting yourselves. Thank you.
Thanks, Paul. Excellent. Thanks, Lynn.
Thank you.